Fortunately, in the modern world, with modern anesthetic agents and very good regulations as to how anesthesia should be performed and standards of practice for anesthesia care, it is very, very rare for a healthy young individual to have a total curveball out of nowhere complication related to anesthesia. It does occur, but a serious reaction to anesthesia that results in a patient death is probably about 1 in a quarter of a million patients. Now, what does it mean for things to be done the right way? Well, it means a Medicare certified surgery center, so all the level of certification that is needed to do things safely, as well as all the equipment and preparations necessary for uncommon circumstances and how to manage them. It needs to be performed with a board certified anesthesiologist or equivalent in the room doing the anesthesia. This can be done at an outpatient surgery center or at a hospital. So, though going under anesthesia can be like really nerve-wracking, and I have even experienced myself because I've had two surgeries in the last 5 years. I had a little tendon injury in my hand and then a shoulder fracture dislocation. But one of the worst things about it was, even for me as a surgeon that's done this thousands of times, was just like waiting there before surgery with that just, sense of concern and unease. It's just very real. So know that it's real. It's normal to feel unease about something that you can't control, but very, very likely anesthesia will be quite boring. And so then the other question was about anesthesia and nausea. So I think that it's always possible to have nausea with anesthesia. That can occur for anybody. The people that are more likely to have nausea issues will be people that have maybe more motion sickness, like in a car or on a boat. And there are things that can be done to mitigate those sorts of risks. Like there's a patch that you can put behind your ear on the morning of surgery or the night before, and that can help with that sort of nausea issues. There's also a protocol that many anesthesiologists are now using called early recovery after anesthesia. There's some variants to this protocol, but it's really to try and get people to recover quickly in the recovery room. And one of those components is, of course, pain control, but another one is nausea. So there can be some things that an anesthesiologist will do and use before and after surgery to make your recovery as reliable as possible. So again, as long as you're in good hands with the surgeon and surgical team following the proper rules for getting somebody through surgery, I think you'll be very likely going through a predictable and in this way kind of somewhat boring part of the process, which is what you want for medicine.